Hi, it's Dr. Allison Rogers, a fertility doctor. I am here with my colleague and partner, urologist Dr. Sam Ohlander.
Hey, how you doing?
So when we're in the clinic together, I try to ask him some on-the-spot questions. He has no idea what I'm going to ask him. But this is a question I got asked today by a patient, and I would love to hear his input. So I have a patient who had sort of poor sperm morphology. So the morphology, the shapes were very low. He started on a multivitamin and some CoQ10 to help with that. And he was asking sort of what % change would you expect out of a supplement?
So I always get put on a spot. This always makes me a little bit nervous, but this is one of the topics that I probably discuss the most in my clinic visits. So morphology tends to be my least concerning factor on a semen analysis. So if we're talking about semen analysis with this. So the morphology assessment, they're typically looking at somewhere between 20 and 200 of these sperm cells. So it's usually a pretty small sample size of the overall ejaculate. And it just doesn't correlate as well with reproductive outcomes. I typically do recommend supplements, even though our data isn't the best on it. It's something that conceptually makes sense that can improve sperm quality. Where morphology matters to me the most is if you are going through assisted reproduction, if you have a team that's looking under the microscope, trying to analyze your sperm for insemination for something like IVF, ICSI, if they're saying that they can't see any normal appearing sperm, that matters to me more than the strict morphology on a semen analysis, because that's giving me a better sense of understanding of your overall sperm quality. I can't give a great percentage variation. On analysis, I just want to make sure that it's not persistently 0%, where I'm concerned you don't have or that concern that you don't have a global defect where your sperm are incapable of fertilizing an egg.
I think that's a great answer. So what I would say is take your supplements like your doctor prescribed, and it's hard to think a supplement's going to make a huge change, but it can always help with sperm production.
It's low risk.
Low risk.